Thank you so much.
Thanks.
Okay. Well, I think what we were thinking about when we first came up with sharing our experience, and Gail we're very much a double act, Gail. We've done the book
Forever.
together forever, and so we'll sort of intersperse with this. But I think one of the things when we were developing the presentation we were thinking of, it's quite interesting to think about people out there watching and listening to us. There are some future and present editors and authors out there. Now, some of you aren't yet authors, aren't yet editors, but you may well be, because when you're invited to do something like author a chapter or edit a book, the first thing you think is, oh my goodness, I could never ever do that. That's something I used when I was a student midwife. But it kind of can happen because you're out there, and I know the expertise is out there. So it's delicious to be here to share just a little bit from the birth or the rebirth of our Mayes Midwifery 16th edition. And Gail, tell us a fact about the Mayes Midwifery that nobody will know.
Well, I think once it landed on my doorstep and I nearly got a hernia picking it up, first thing I did was went and weighed it, and it weighs in at a hefty 3.5 kilos.
Yay.
That's a heck of a lot of knowledge and information crammed into the space that Neil has shown us already. It's pretty hefty. Very good reading, also keeps the doors open.
Not such a good use of a textbook there, Gail. Anyway, before we started, we had to do some work, but also Elsevier, who are the publishers of the book, also did a lot of work, because obviously it's in their interest to make sure the book is right for the group of people who are going to be buying the book and using the book on a day-to-day basis, some of them. And these are the kind of things that they came up with. And we were aware that the courses are hugely varied, even though the student outcomes, especially in the UK, are going to be the same. But the things that students wanted was plain and simple English. They like bulleted lists, they like boxes and headings, they like reflective exercises and case studies, because that brings the content alive and makes it easy to understand some of the quite hefty research and evidence and theory that's in there. They also like a few up-to-date references, which we do too. The diversity and inclusion was a big one that came up, but also was very near to our heart. We had to align to the NMC standards, and we had to have them they were approved by students. So there was a lot of groundwork and a lot of thinking before we started working. But as both Gail and I are teachers, we have to make that confession. We also were aware we needed to give student readers, or midwife readers actually, what they wanted, but also what they needed, which may or may not be the same thing. Sometimes it's a wee bit different. Gail, did you want to say anything there?
Well, I just think one of the challenges when you're looking at a textbook, if you're reading a novel or something, you go through page by page. And obviously with a textbook, sometimes you just need to access the information quickly. So you need to get to the chapter you're looking for and pull out the information that hopefully you've already read through, but just as a reminder. And this information that we got from the review that Elsevier did and talking to the students is exactly what they want, because you can just dip in and out. And here's a list as a reminder of what you've read, but to make sense. But it is the application to practice, I think, that was so important. It's all very well having this knowledge, but it's that, so what's that got to do with me when I'm out in practice? And hopefully how we've brought it together just does that.
I think it's very important that people don't just keep it on a bookshelf, that they do dip into it. So that's fantastic.
Yeah, and not just as students too, as you said, Sue. I mean, it's something that, I know that you and I, Sue, have always used it when we're teaching or in practice as well. So we just give it out there.
Yay. Well, we went back to the 15th edition. We can honestly say that we've read both of these books cover to cover, because we have. But we were very aware that from the feedback we got from student readers and from teachers and from midwives, that it was very highly evaluated the last time. But And at that point we had a quite a different approach to women and babies. We'd used contemporary society being acknowledged, all the stuff around psychology and sociology and sexuality, and the choice and patterns of care. And of course that's been changing. It just seems as though it's been going on forever. It's just been changing, and you kind of, when you read one of the older books, you kind of realize how much it has been changing. You have to make sure it's keeping up with it. And one of the big things for me was about the strong physiology applied to practice, applied to maternal, fetal and neonatal care. So you'll see a lot about that in this next edition also. And also that the thing that is also important to remember, because this has meant an enormous amount of work for our wonderful authors, is it's not just in the book, which is huge. It's huge and thick, but also there's a whole chunk of things online. Every chapter has got some online materials, it's got online quizzes, it's got online additional references and research and articles that they couldn't fit in. Because if our authors had put everything they wanted to put in the book, it would be even bigger and probably would have been an 8-kilo baby. So we have to be careful on that one. Okay, and we know that, I mean, part of the responsibility is knowing it's all over the world and people access it in small or larger degrees. I mean, obviously it's UK focused, but we were very aware, both in the use of it, but also in what is included, to make sure that there was international focus, because there are some things, gosh, that other countries do better than the UK, and we needed to acknowledge that and make clear of it.
And certainly, you know, the international research that will inform practice globally, recognising that, and of course some of our authors are also non-UK based too, so bringing in their expertise.
That makes it really interesting. Okay, and so it began, the 16th edition. It feels a lifetime away, I have to say, that we sat down and started looking at our authors and choosing people. Some people wanted to stay as authors, some people had moved on to other things. So it gave us a nice opportunity to have some existing authors and some new authors, which was lovely. But also we were really happy about this, is having chapters where there was more than one author, which got tricky sometimes, because sometimes, you know, people had a different viewpoint, but actually it gave every chapter a strength, and that was really good. Obviously research and evidence was really strong within there, and we were really working very hard on reflecting society and the women served by midwives and families, of course. And we were very focused on language and the need to address unconscious racism and bias, because that became an incredibly important part of what we were doing. And that linked in, I have to say, to images. And that was a real challenge, because it became really clear to us as we were thinking about it and working with the authors, that there weren't the images that we wanted out there. It's much harder to get properly black and brown images, not just the ordinary white. I shouldn't say ordinary, it's not ordinary, but the ones that have been for years and years. Even in the line drawings, we were having to request and say, we can't just have these very white images, because that doesn't reflect our midwifery and maternity services. But it did challenge us, and I hope we've started. I don't think we've got it perfect, but we're on the roadway. Sorry,
I think so. We started that process with the 15th edition, trying to challenge the language, trying to be more inclusive and have that understanding. And we started that process of looking for images with the 15th edition. And yet, you know, several years down the line, we were still finding it was a big struggle. So although we're aware of it and we're raising awareness of it and people are talking about it, we haven't yet got the solution to it. But it's something that we and other authors and publishers are desperately working on, because it's so important, and is reflected, as Neil said, you know, in the embrace reports and the 5 times more. We're just letting women down. by not addressing this.
Yeah. Okay, and then the other headaches we had, I will mention, is the
Headaches.
copyright headaches, because that became an issue about making sure that all the material we were using was copyright okay, we had permission for everything. Sounds very simple, but when you're looking at 72 odd chapters with very varying images and different tables, some were easier to get than others, and that was an additional thing for us to chase up. I don't know. And then now this image should be a little cat typing madly, because that's what a lot of the process was about. I couldn't get a moving cat. But we looked at, before we invited our authors, we carefully reviewed them, looked at what was needed and provided key things. We didn't want to hamper people, but we wanted to make sure they knew the direction that the chapter needed to go in, especially our newer chapters, which needed to, well, it's almost like a blank canvas. Blank canvases can be quite difficult to start with. And some of the chapters needed a general update. Some of them had massive changes within practice and needed a lot more work. So we were able to kind of give that guidance. And we needed, I guess, for some of our authors to make sure people understood that it was different to a textbook's different to an article. And those of you who are listening who might be thinking, well, it's just a bit of writing and a few references. It's a bit different, because you have to give students who may be the readers a kind of a roadmap through the topic. You can't just go into huge theoretical debates. I think Gail wants to say something. I have that feeling.
Well, I was just going back to sort of looking at how we talked about the content, Sue, and looked at what was what. I know sometimes when you see student forums and they, students finish their training and then they sell on their old copy of the textbook. I think it's sometimes fail to understand how quickly the evidence changes around certain topics. And that's why we need to reflect that, and how the chapters need to show we're not just updating them for the fun of it. It's that the evidence has changed, and so that we're keeping the readers revised with fresh information all the time. And that, I think, that's one of the challenges, that they are reading the right content, and that somebody that's coming in to write for us is aware of how things have changed, because when you have a textbook that you really like, you want to stick with that format, but sometimes you've just got to look at it differently to get the information over in a more, I suppose, an easier way sometimes.
Yeah. And I think it's also hard. I don't know whether our authors might say the same, but I know I found it difficult to drop bits of old knowledge in the chapters that I was writing, because new stuff had come along and you just can't fit everything in. And of course, the other thing that the publishers needed to understand is some of our references were a bit older than 10 years, where there hadn't been any further research. We were using sometimes older bits of research. The key thing was references had to be perfect. And I have to say, Gail and I are absolutely obsessive about references. And you'll hear more about that at some point, I'm sure. The next sort of thing that we worked on, once we'd invited people to be part of the journey, was we wanted to kind of get a community, because it can be really lonely when you're writing something. And we wanted to make sure people felt informed, but also could inform each other and share information, especially if one person was writing a chapter, they could share one snippet with other people. So we chose a kind of closed Facebook group, and that in itself was interesting, because a lot of people applied to be part of it that weren't our authors. So it was obviously very interesting, but we didn't let anyone else join. So it was closed and safe, but it also meant people could share new bits of research that were coming along, new things from NICE, which was really important. And also sharing things that were difficult that we could debate a bit and kind of understand a bit more. And we also organised a whole series of seminars, and we had lovely presentations from Tina Closton, and I just want to say Errol, because that's how we know Dr. Errol, Bernie Deval and Joy Kemp, who were also our authors, but who shared their knowledge of their particular chapter. So it gave us a kind of different feel, and that was really nice. And it was a way of us coming together, keeping up with how people were doing with their timelines, and also just sharing and feeling as though we're still together. And we're still running the Facebook page. And I've just posted the Embrace, I want to say CMAC, without the Embrace, and I was going to do the APPGD. I haven't done that yet, but it's still a way. We want to carry on with a bit of sharing, I hope, or I do. I like to share. Gail, I don't know.
Yeah, I agree. I think it's a good opportunity to see what else is going on. So although, you know, the book is now finished, it just means, you know, the authors are still out there producing some really good content. And, you know, that keeps us thinking about what else is out there and what else we might need to be doing. And, you know, and hopefully we might be able to support other midwives in continuing their writing skills. So I think that's a good way of doing it. And before we move on, I'd just like to point out this little image here on the right of the new parents and the baby. That's my grandson.
Oh,
I just got to get a little plug out there for baby Jude.
Thank you, Gail.
Who is nearly 4.
Oh, crikey.
Yeah,
that just shows how long it takes.
How long it's taken, yeah.
The gestation's a bit longer than normal.
Yeah.
For us, I mean. And then just to share some of the challenges, and I know that we're running, I knew because we're talking a lot, the challenges, of course, we were asking key people in the profession, the busiest people. And if you ask a busy person, they've got to juggle their whole life. And that's really hard, especially with deadlines. Some of our deadlines kind of moved, and it wasn't anything to do with Gail and I. It was because of the wider world. I suspect it was probably to do with COVID and after effects in the rest of the publishing world, but we just had to deal with that. And of course, there were things like new documents and policies coming through, like, for example, NICE published something fairly soon, just as we were about to finish proofing. And I think anxiety about writing for a textbook, I think it's always there for all of us, because will we get it right? Have we remembered everything? Have we you know, used something old or outdated? And that's always anxiety. So the new and the old knowledge, and of course the references, because as I said, Gail and I are obsessive, and a lot of the time was spent in matching all the references through and making sure they were all correct and they were all the same and all consistent, which is always a bit of a pain.
And I think as far as deadlines, sorry, Sue, just going back to deadlines.
I'll put them here.
the authors have a deadline, but as editors, you have a deadline, and as editors, we're juggling 72 chapters, and on the whole, most of the authors perhaps had 1 or maybe 2 or 3, and so I think it's about understanding how your individual work fits into the whole collective within a textbook, and the impact that you can have on the whole production of it, which can be quite frustrating. And you know, you write something, submit something, and you're very pleased with it, and generally so are Sue and I, but there's nearly always something that needs to be reviewed, and it's about, you know, looking at those deadlines, thinking, oh, I've got plenty of time, and we all know how time goes so quickly. So when somebody does ask you to write something, start it straight away. Yeah, definitely.
I think that it is such a challenge, and also the proofing took a long time. It was late coming through for us, for all of us, and it was a big task. So eventually we got published in May and June. I'm very conscious of the time, and Neil probably will send up a sign to me, but I just wanted to share, now we have 80 authors, 80 wonderful authors, and they were all fantastic. and really patient with us squeaking at them and saying, oh, can you do this? Can you whatever at very short notice. We haven't got them all here, but the plan is to have a massive collage of every single author, hopefully clutching a copy of the book if they can possibly manage the lifting of it. So we can kind of show that at a future event, because I think it's wonderful to see people's faces and who they are. This is the great and the good in midwifery and maternity services, and it's so nice to have everyone there. Some people did some very creative things, like Alicia did a lovely clip on Twitter, wasn't it, and Instagram, I suspect, as well. And also Laura Godfrey and Isaacs and Sally Pizarro also did a lovely thing. So there's a lot of creativity in this group of people, and they are fantastic. No word of anything. So we'll say a huge thank you to our readers and the team at Elsevier. We had Poppy, who started the whole process, which was then taken over by Andrea Ake, and Shruti Raj was the project manager, making sure everything was coming through to us as it did. So it was a process of ups and downs, but when you go into that, and I know Gail would want to share that, probably going into a bookshop. Should we finish off with Gail and her bookshop?
Well, yeah, it's just one of those exciting moments when you go into Waterstones and you see a copy of the book. It's just very special. I have been known to be standing there getting my photograph taken. People think I'm completely bonkers, but then anybody that knows me would know that anyway. So, and it is a labor of love, but then so is the profession, isn't it? So
it is.
It's a joy to be working with such fantastic people.